For my discussion post, I chose to talk about the mandatory vaccination mandate for the United States frontline workers. As of Monday, July 26, 2021, the Department of Veterans Affairs have chosen to require coronavirus vaccines for all healthcare and frontline workers. Since the start of July 2021, we have confirmed that the coronavirus infections nationwide have quadrupled. Numbers show that nearly 60% of adults are fully vaccinated, which is amazing. But on the other hand, the article states that many healthcare workers remain unvaccinated despite them having priority access to the vaccines which became available to them back in December. The article states that more than 38% of nursing home staff were not fully vaccinated as of July 11th of this year. In my opinion, this is ridiculous, considering older people have an elevated risk of getting the coronavirus. As of last Thursday, fewer than 9% of hospitals had required their workers to get vaccinated. Healthcare organizations had been avoiding imposing vaccination mandates due to the fear of the risk of lawsuits or staff defections. My take on the subject is I feel that this should have been mandated a long time ago when the vaccination came out to begin with. It doesn't make sense how cases are continuing to rise and there's healthcare workers taking care of these infected patients while they aren't vaccinated. Even patients who aren't infected are at great risk due to the healthcare providers that are refusing to get vaccinated. I understand that everyone has different views on medication and vaccinations, but at the end of the day, getting vaccinated to help reduce the spread of the coronavirus is what's in the best interest for health and safety of United States workers, families, communities, and the nation as a whole. So for the ethical framework part of this, in the Nursing Now textbook, an ethical framework that will support my position in mandatory vaccination is utilitarianism, which this is a concept that draws on past experiences to formulate guidelines that are useful in determining the greatest good. So I took this as it supports mandatory vaccination because the rising numbers of the coronavirus, due to that, they have decided to mandate the vaccination for all healthcare and frontline workers. So taking numbers from the past, they have decided to do this for the better good of our nation.